This is Brent live from Rick Ritchie's Independent Training Spot, the new home of the Brookbush Institute. I'm very excited to be here. Very excited to be doing our next self-administered mobilization video. In this video, we're going to look at the shoulder and how we can increase range of motion, increase arthrokinematics, that surface-to-surface motion between the humeral head and the glenoid fossa. Now, with all of the changes in muscle activity and length, in upper body dysfunction, people have a propensity towards anterior and superior migration of the humeral head in the glenoid fossa. So what we're going to be looking for is how do we stretch out these inferior and posterior fibers of the capsule. I'm going to have my friend Aaron come in. He's going to help me show you guys some techniques I've been working on. Now, these techniques are going to look a lot like our hip mobilization video. If you guys remember from what I was talking about in that video, I talked about anterior and superior glide of the femoral head and the acetabulum. So it's all very similar. Instead of putting the band around his hip though, I'm going to put the band around his shoulder, and then you'll see the logic flows very, very similarly. So let's have you get in a quadruped. Put that way up high around his humeral head. Now, you see Aaron starting here on his hands. We've been experimenting with this a little bit, and I can tell you up on the hands doesn't work out quite as well. And my thinking is that it activates your tricep, which the long head of your tricep does cross the shoulder. And I think it activates the rotator cuff a little bit to be in this position, which makes mobilization of this joint a little less effective. So I'm going to have him get down on his elbows. Now his shoulder's in a little bit more relaxed position, and even just a little bit of force, I can feel that humeral head come away from the glenoid fossa. All right, so we're going to put this up nice and high. Now, the position we have here, this would be a lateral distraction of the humeral head. Lateral distraction, just like for the hip, is a nice general mobilization that is going to get those inferior and posterior fibers that are tight. In this position, this is a technique I use as an introductory shoulder mobilization. All I'm going to have him do is rock back and forth a little bit. The same thing we do with our manual techniques, maybe 1 to 2 oscillations per second. He can count to 15 or 20, or we could go even more oscillations than that and say, okay, go ahead and keep doing that for 30 seconds. How does that feel?
Really good.
All right, so this is kind of that mobility work, those grade 3 and 4 mobilizations we've been taught. Like I could even go more towards a grade 4 by going, okay, well, what if we bring your elbow in and I really challenge him at his end range here, all right, and then rock. And he can adjust his hips as he needs to. How does that feel? Good. A little more intense, right?
Absolutely.
We could then start thinking about a little bit towards mobilizations in different ranges of flexion and extension. So maybe I've been getting him closer and closer, more and more flexion, getting closer to optimal. Instead, I just have him, maybe this is as far as he can go. I'm going to have him bring out both arms so he's even. Good, and now he can rock back and forth there at 130 degrees of shoulder flexion. Okay, we can take it even one step further. We could do these mobilizations with motion. And now what I could have him do is go, okay, we're going to do this little bit of lateral distraction, but I want you to keep center.
Okay.
All right? And this time, I want you to rock back and forth between neutral and as much flexion as is comfortable for you. How does that feel?
Feels great.
All right, so now we got that lateral distraction while working on flexion and extension. This one works wonderfully. It's a very comfortable position for the client or patient. And he can go through the same kind of reps. We're way over mobilizing his shoulder right now, guys. Please don't go through all of these in one session. You will end up with a little hypermobility, and that can be painful. All right, so the next technique we're going to work on, actually, let me take one step back. The one thing you could do, going back towards our grade 1s and 2s that we've been taught, if somebody had a painful shoulder, remember we could limit range. You can use any of these techniques, but limit the range just to pain-free range of motion. So let's say he has a little bit of pain at 110 degrees. He's got a little bit of that shoulder impingement issue. All I'm going to do then is he'll rock back and forth, just touching where that pain is until that pain goes away at that range, and then he can move a little further. All right, so hopefully you guys are putting this all together. We can just oscillate. We can oscillate at the end of range. right? Either flexion or adduction. We can oscillate with flexion and extension, or we can just go through pain-free range and start working in smaller ranges of motion until that pain goes away. Now, another technique that is definitely a progression from this. This technique I'm about to show you is a lot more aggressive. It's very effective for a stiff shoulder though. I'm gonna have Aaron flip around. So bring your backside this way. And what we're gonna do is a superior to inferior mobilization. This is a big one. What he's gonna do though, is he's gonna get his arms up on a foam roll. And what most people would wanna do is just go forward. I'm sorry, keep your arms right where they are. Most people would just wanna go forward with their body. The problem with that though, is as the band's pulling him back, his arm's going back, so we're really not getting a mobilization. The hard thing to teach with this one is they gotta keep this in the relatively the same position while pushing from their feet so that they maintain this, and it is truly a superior to inferior glide, and he's just gonna rock again. The foam roll allows his upper body, this little position we're making, to stay in one piece. Unless I want to get even more aggressive. You guys could turn this into a mobilization with movement once again by having him push with his feet and reach with his hands and do as much flexion as he can get. And I'm sure Aaron can feel that's a very, very intense technique. I would definitely be careful with this one. Maybe start with just 10 or 15 repetitions and reassess before letting somebody go and go and go and go, and all of a sudden you look over and your patient's been doing a very aggressive technique for a minute and is going to start having some shoulder pain. Once again, if this was a painful shoulder, I could limit my range of motion to wherever I needed him to be so that he stays out of that painful arc and stays right in that pain-free zone and just touches the pain. Same thing. We could do the same thing with the mobilization with movement, right? Maybe he just has a little shoulder impingement and he goes right up to there, he feels it, and backs off. All right, so that is a ton of stuff for you guys to work on. We did lateral distraction with more adduction, lateral distraction with more flexion. We did mobilization with movement and lateral distraction. We did a superior to inferior glide. We did a superior to inferior glide with flexion. I hope that gives you a ton of stuff to work on. With this particular technique, guys, please be careful. The shoulder is a much more delicate structure than the hip. Make sure that you assess, you try a few of these techniques, you keep the reps low initially, and then reassess. If you got a good outcome, stop. If you reassess the next session and their shoulder mobility is fine, don't do this technique. There's no need to start pushing them beyond what is optimal. Remember, hypermobility is a problem as well. I hope you guys get great outcomes. I look forward to hearing from you. Thank you, Aaron.
Thank you.